Hi, everybody. My name is Sachita Shah, and I'm going to speak with you about ultrasound in limited resource settings in telemedicine and tele-disaster. So I am the Senior Director of Global Health at Butterfly. We make a whole body ultrasound probe and whole body ultrasound system. And so I'm going to zoom out and give you an overview of our global health program, and then talk more specifically about ultrasound and its use in disaster. So I'm an emergency physician. I did some ultrasound fellowship training after my residency training, and my career has been peppered with research projects related to ultrasound and point of care ultrasound in the hands of clinicians themselves, at the point of care, at the bedside of the patient, in humanitarian response, and in disaster, as well as in health system strengthening in low or low middle income countries and remote settings. So I have prior global health experience in many different countries, teaching and providing ultrasound and clinical care prior to joining Butterfly team. Our mission at Butterfly is to create valuable clinical insights by using innovative ultrasound technology. So we are the first and only completely chip-based ultrasound technology. We can plug our probe into any number of different screens, so tablets, phones, and it's an app-based software system where we can receive the ultrasound image information and also integrate teaching into the app. Many of our use cases are augmented by artificial intelligence and makes the technology quite easy to use for clinicians who are not sonographers or radiologists. So, as a background, disparities in global healthcare are quite prominent. Just for reference, in Boston, in the United States, the annual expenses for 1.5 million patients that are seen through a big Boston healthcare system, annual expenses are upwards of 11.5 billion US dollars. Compare that with a healthcare system in Tanzania or in Haiti, and you see that the amount of money spent on healthcare per capita is just much, much lower in a limited resource setting. And then it follows that the under 5 mortality rate is much, much higher, as is the maternal mortality rate. So the other kind of issue that is on the global health landscape is that diagnostic imaging is quite rare to find throughout the world, especially in low income or rural settings. So there are severe equipment shortages for CAT scan machines, which allow clinicians to see inside the body using radiation. And there's less than 1 CAT scanner per million people in low and middle income countries. Compare that to 40 scanners per million people in high income countries. So clinicians in high income countries simply have more access to imaging tools to be able to answer clinical questions by seeing inside the body. When we consider advanced imaging such as MRI or nuclear medicine, again, that gap is very, very high. And there are many, many countries and even regions of the world, including several countries, without any access to MRI or nuclear medicine studies. There are also severe workforce shortages among radiologists, so physicians that are specialized in radiology imaging, including ultrasound and reading CAT scans. And so as a reference point, there are more radiologists in the 4 major teaching hospitals in Boston in the United States than there are in all of West Africa. So quite a dearth of physician specialists. There is a dearth of sonographers, so people to perform the actual ultrasound to make the images for radiologists to read. And there's a shortage of training programs to produce more. So we have equipment shortages and workforce shortages. So that's why the development of handheld ultrasound technology is super important and how it can affect patient care, because there are these shortages. So the Butterfly probe is a whole body probe. So we can use our technology to change the megahertz of the probe so we can see superficial structures, deep structures. And so it really is one whole body probe as opposed to needing multiple probes in a traditional ultrasound system. Applications in disaster that are useful include a FAST exam, which is focused assessment with sonography and trauma. We can use the ultrasound to look at the heart for blood around the heart if we have a cardiac injury. We can look to see if there's blood in the abdomen, and studies have shown that when we find bleeding in the abdomen, patients have a faster route to the operating room than if we just didn't know they were bleeding internally. And another kind of injury that's common in disaster, especially in humanitarian crises such as war, are chest injuries leading to a collapsed lung. And that's something that can quickly kill a patient, but also quickly be temporized with the right diagnosis made at the bedside. And so ultrasound can be very useful in detecting a collapsed lung or pneumothorax. So at Butterfly, we have now over 2,500 probes distributed in global health settings in 60 plus countries, and we have over 250 global health partners. We recently launched a 1,000 probe partnership in sub-Saharan Africa to show what happens when we deploy ultrasound at scale. So this was not in a disaster setting, but in a more health system strengthening setting, looking at ultrasound paired with training in the hands of midwives. We've been supporting the Ukrainian relief effort, and so ultrasound is highly useful in kind of frontline providers, as well as in hospitals taking care of patients with war-related injury. And so we've partnered with Health Tech Without Borders for this, and multiple other organizations as well. So within the first 100 days of the conflict, we had over 165 probes deployed. Because our probes are handheld, lightweight, and can be plugged into almost any Android or iOS-based tablet or phone, the technology is ideal for use by clinicians on the front lines of a humanitarian crisis, such as a war. So specifically in war, as I mentioned, our probes are ideal because we can provide a lot of information at the scene of where an injury occurred that can help a clinician decide whether to immediately evacuate a patient versus stabilize them on the scene. We have tele-guidance capacities, and I'll talk more about that in a second. Our equipment is drop tested and can function off the grid indefinitely in what we call mission mode or extended offline mode. And it is in use by the US Special Operations as well as NASA in space. So in lots of remote areas where being offline is important. Some key clinical applications in humanitarian crises include the FAST exam, like I talked about. Is there blood in the belly or no blood in the belly? That's a very binary piece of information that a clinician can use to send the patient to the operating room or say, hey, they can wait and somebody else can go. And then also intravenous access. Sometimes when a patient has shock and they're bleeding quite a bit, it can be difficult to get an IV in them because their veins are quite collapsed. Ultrasound can help, and that's what this picture is showing here, is using ultrasound to guide a needle into a vein to be able to give blood products or fluids or resuscitation for a patient. So tele-ultrasound is pretty new in the last 5 to 10 years. Butterfly has a remote teaching capacity and also remote clinical application capacity. And so we can use through the app and through someone sitting at a desktop in a different part of the world, they can see not only the ultrasound screen of whoever is performing the ultrasound, but also they can see the learner or the user's hand. And so with their hand motion can be guided by whoever the trainer is or the teacher or the teleguiding physician who is viewing the whole procedure remotely. So we can say to a novice user, okay, I see your screen and I'm seeing this piece of anatomy. Now I want you to tilt your hand a certain way so that I can see, okay, yes, that is an example of X or Y, and help them make a decision on the spot within minutes for a patient's clinical condition, even if all they know how to do is plug the probe in and turn on the teleguidance. So that's a pretty exciting new feature integrated into Butterfly. So the other kind of features that make it ideal for use in Tele-Disaster is you can have the opportunity to have just-in-time learning through the app. So ultrasound is a hands-on operator-dependent skill. And if you haven't gone to a training session or school, it can be, you need some sort of training to be able to use the equipment. Now, ideally, folks that are receiving the equipment have a baseline level of training, but in addition, within the app itself, we have just-in-time learning videos and also an entire Butterfly Academy, so we can assign courses. And many of our partners in working in the humanitarian crisis that is currently ongoing are using Butterfly Academy for this role in teaching and supporting the learning of their users. Images leave the Butterfly and go into the cloud, and then can be sent for remote review or quality assurance. They can be sent without patient information to keep it private if that's preferred by the clinician. And they can be sent with patient information through our secure cloud. They can be viewed in many different formats remotely. And then we can also integrate into our cloud many different third-party ultrasound devices as well. And the data is secured. It's considered in the US, we have our system called HIPAA, so it's considered HIPAA compliant and in adherence with patient privacy laws in the United States, and is approved for regulatory use through the governments of many different countries. And so we send the information of the patients and their images quite securely through our app. So it's an exciting integration of not only training and just-in-time teaching, tele-guidance capacities, as well as the use of the cloud to send information. For example, if a clinician is sending a patient in a disaster, they can send the images ahead to the surgeon saying, hey, look, I just did a fast exam and this patient has an abdomen full of blood and they're going to need an urgent operation, and let me send you the picture to prove that. And so that actually really speeds time to diagnosis and also to better outcomes for patients. So short and sweet little overview of Butterfly uses in to Tele-Disaster and also in telemedicine. And so I know this is a recording, and so I hope you use this information. And if there are further questions, you can contact me through Health Tech Without Borders. So thank you very much for listening.